Childbirth is one of those experiences that nearly every culture in the world understands, but how it actually unfolds can look very different depending on where you are and what choices you make. In the United States, one of the biggest dividing lines between birth experiences comes down to a single decision, whether to get an epidural or to go without pain medication. And when we look at cervical dilation, which is the process of the cervix opening to allow a baby to be born, the difference between these two paths becomes really clear. So let's start with the basics, because before we can really compare, we need to understand what cervical dilation actually is. The cervix is the lower part of the uterus, and during pregnancy, it's firm, closed, and acts like a protective barrier. But when labor begins, it doesn't just suddenly open wide. It softens, thins out, and then begins to open in gradual stages. This opening is measured in centimeters, from 0 to 10. At 10 centimeters, the cervix is considered fully dilated, and the body is ready for pushing. Now, here's the part most people don't realize. That journey from 0 to 10 doesn't happen at the same speed for everyone. Some women move quickly through the first few centimeters and then slow down dramatically later. Others dilate slowly at first and then progress quickly at the end. It's unpredictable. But what really shapes that timeline and the experience of how it feels is whether a woman is laboring naturally or with an epidural. In the United States, epidurals are very common. About 70% of hospital births involve one. An epidural works by numbing the lower part of the body, blocking the pain signals from the contractions. For many women, this can be a huge relief, especially during long and exhausting labors. But here's where it connects to dilation. Because the body is numbed, the natural feedback loop of pain leading to hormone release, leading to stronger contractions, is interrupted. The body produces less oxytocin, which is the hormone that powers contractions, and with weaker contractions, the cervix can open more slowly. That's why women with epidurals are often given Pitocin, which is a synthetic form of oxytocin. Pitocin strengthens contractions and helps the cervix keep opening. In other words, with an epidural, dilation is often a more medically guided process, with nurses and doctors monitoring progress closely and adjusting medications to keep things on track. Now, compare that to natural birth, where no pain medication is used. In natural labor, contractions trigger oxytocin release, oxytocin intensifies contractions, and the cervix responds by opening. It's a cycle that feeds itself. Women who are free to move around, whether that means walking, squatting, kneeling, or even just shifting positions, often find that this movement helps gravity pull the baby down, which in turn helps the cervix open. That's one of the big differences. With an epidural, mobility is limited. Without it, movement can be a powerful ally in speeding up dilation. But that doesn't mean natural dilation is automatically faster or easier. The mind plays a huge role. Stress, fear, and anxiety can release adrenaline, which slows down oxytocin. If a woman feels tense or unsafe, dilation can stall even if the body is otherwise ready. This is why some women in calm, supportive environments, like home births or birthing centers, report smoother progress compared to women in stressful hospital settings, even though both are unmedicated. So at this point, you can already see how differently cervical dilation can unfold depending on the path chosen. One is shaped by medication and careful monitoring, the other by the body's own hormones and environment. But both have their pros and cons, and both are valid. As we move further into labor, one of the most fascinating differences between epidural and natural birth shows up during what's called the active phase. This is when the cervix is usually between 4 and 7 centimeters dilated. For many women, this is the point where contractions become stronger, closer together, and much harder to manage without support. With an epidural, this is often the stage where things slow down. Because the body's natural hormone rhythm has been interrupted, contractions can lose intensity. Doctors and nurses will often step in with Pitocin to keep dilation progressing. This is why hospital labors with epidurals tend to involve more IV drips, continuous monitoring, and medical adjustments. The goal is to keep the cervix opening at a steady pace so labor doesn't stall. Without an epidural, the active phase looks and feels very different. Contractions are strong and painful, but they are also the body's most powerful tool for opening the cervix. This is when movement makes a big difference. Women who are able to walk, lean forward, rock on a birth ball, or squat often notice their cervix opening more efficiently. The pressure of the baby's head against the cervix during these contractions can speed up dilation. And because the body is still producing oxytocin naturally, the contractions usually build in intensity without outside medication. Now, the transition stage, when the cervix goes from about 8 to 10 centimeters, is another area where the difference is striking. For women with epidurals, transition can feel like any other part of labor because the pain is dulled or absent. The cervix may continue to dilate steadily, but sometimes the body loses the natural urge to push because the sensations are so muted. This can make pushing take longer and often requires more guidance from the medical team. For women without epidurals, transition is often the most intense and overwhelming part of labor. Contractions are strong, close together, and feel almost unbearable. But at the same time, the body is releasing a flood of hormones that prepare it for pushing. Many women describe an irresistible, instinctual urge to bear down as the cervix reaches full dilation. The stage can be frightening, but it's also a sign that the body is working exactly as it's supposed to. Here's another layer that's unique to America: the way hospitals measure and manage progress. Traditionally, doctors used something called the Friedman curve, a chart that says dilation should move at about a centimeter per hour during active labor. If it doesn't, interventions are often suggested. But more recent studies have shown that many women don't follow this pattern, especially those with epidurals. Some dilate slowly without any problem at all. Still, in the US, there's often pressure to intervene if dilation doesn't match expectations, which can lead to more Pitocin use, breaking the water, or even C-sections. In more natural or low-intervention settings, like home births or birthing centers, the timeline is often treated more flexibly. If the baby and mother are doing well, providers may allow labor to unfold at its own pace, even if dilation is slow. This difference in approach is part of why the experience of dilation can feel so different depending on where and how a woman gives birth in America. Once the cervix reaches that final point, 10 centimeters, the body's technically ready for pushing. But the experience of pushing looks very different depending on whether an epidural is in place or not. For women with an epidural, pushing often becomes a guided process. Because the pain is reduced and the natural urge to bear down can be dulled, nurses and doctors may instruct mothers on when and how to push. This can make the pushing stage longer, sometimes taking 2 or even 3 hours, especially for first-time moms. On top of that, the limited mobility from being numb waist down means that positions like squatting or kneeling, which can use gravity to help, aren't possible. Most women with epidurals push while lying on their backs or in a semi-reclined position, which isn't always the most efficient way for the pelvis to open. On the flip side, natural births often come with a very powerful, almost uncontrollable urge to push once dilation is complete. Many women describe it as their body taking over, with contractions practically forcing them to bear down whether they want to or not. Because movement and position changes are possible, women can push in ways that align with their instincts, on hands and knees, squatting, standing, or even sideline. These positions can speed up descent and reduce the pushing time. That said, the pain and intensity are at their peak, so support, encouragement, and breathing techniques are absolutely essential. Another important difference is how the medical system responds if dilation and pushing don't line up with expected timelines. In hospitals, if pushing doesn't result in progress after a certain number of hours, interventions such as forceps, vacuum extraction, or C-sections may be recommended. This is more common with epidural births, where both dilation and pushing can move more slowly. With unmedicated births, as long as the baby is tolerating labor well, midwives or providers outside hospital systems may allow pushing to last longer before intervening trusting the body to finish the process. And then there's the aftermath. Cervical dilation doesn't just stop at birth, it affects recovery too. When cervical dilation is slowed by interventions like Pitocin or assisted deliveries, women may feel more exhausted afterward or face longer recoveries due to tearing or surgical births. In natural labors, where the cervix opens steadily with the body's rhythm, recovery can sometimes be faster, though not always, since every birth is unique. What all of this really shows is that cervical dilation is not just a mechanical measurement. It's a reflection of how the entire labor experience is unfolding. The way a woman's cervix dilates tells the story of her body's natural processes, her pain management choices, the environment she's in, and the medical culture surrounding her. So what does all of this mean for expecting mothers in the United States? The first and most important truth is that cervical dilation doesn't look the same for everyone, and it doesn't follow a perfect timeline. Some women dilate quickly, some slowly, some steadily, and some in fits and starts. What shapes that journey is not just biology, but also choices about pain management, the environment of birth, and how providers respond. With epidurals, the benefits are clear. They offer relief from intense pain, reduce exhaustion, and allow many women to experience labor without being overwhelmed. But the trade-off is that dilation often slows down. Contractions may need to be strengthened with Pitocin, and mobility is limited. These factors can lead to longer labors and sometimes more interventions. Still, for women who need or want that relief, the epidural can be the tool that makes childbirth feel manageable and even empowering. With natural births, the process of dilation tends to follow the body's hormonal rhythm. Movement, gravity, and instinct can help the cervix open and the baby descend. Many women find that this can shorten labor and make pushing more instinctual. The trade-off, of course, is the intensity of pain, which can be overwhelming. Stress or fear can stall dilation, and without medical interventions readily available, complications may be harder to address quickly. Still, for women who want a more body-led experience, natural birth offers a powerful sense of connection to the process. What's also important to recognize is the cultural layer unique to America. In hospital settings, labor progress is often measured against strict standards, and if dilation doesn't happen fast enough, interventions are encouraged. In lower intervention settings, the pace of dilation is treated more flexibly, with the focus on how the mother and baby are doing rather than how many centimeters have been reached per hour. This cultural difference means that the very same dilation pattern that is considered too slow in one setting may be considered perfectly normal in another. So the real takeaway is this: there is no single right way for cervical dilation to unfold. Whether a woman chooses an epidural or a natural path, what matters most is being informed, prepared, and supported. If you choose an epidural, know that your dilation may be slower down, and that Pitocin may be offered to strengthen contractions. You can ask your provider in advance how they monitor progress, what their policy is for slow dilation, and how much time they're willing to give before suggesting further interventions. This way, you walk into labor ready for the realities of how your cervix might respond, instead of being surprised in the moment. If you're planning a natural birth, preparation looks different. Instead of focusing on medication, you'll want to build strategies for coping with the pain of contractions, breathing techniques, movement, massage, water immersion, or hypnobirthing practices. You'll also want to think about your environment, because we know stress hormones can slow dilation. Having a supportive birth team, a calm atmosphere, and the freedom to move can make all the difference in how your cervix opens. It's also valuable to remember that birth doesn't always go according to plan. A woman may begin labor intending to go natural and later choose an epidural.
Or she may hope for an epidural and discover labor is progressing too quickly to get one. Cervical dilation doesn't follow a script, and flexibility is key. What matters most is that mothers understand the dynamics at play so they can adapt without fear. At the heart of it, cervical dilation is not just about numbers on a chart. It's a story of how your body, your choices, and your environment come together to bring your baby into the world. Whether that story unfolds with the steady rhythm of natural hormones or with the guiding hand of medical tools, the outcome is still one of the most profound human experiences: the birth of a child. So when you hear someone say, she was only 3 centimeters after hours of labor, or she got to 10 really quickly without meds, remember that these numbers are not judgments. They're part of a bigger picture, one shaped by countless factors. The real power lies in knowing what influences those numbers and using that knowledge to feel confident in your own journey. And that's the message every mom in America deserves. Not pressure, not fear, but clarity. Because the more we understand cervical dilation, whether with an epidural or without, the more we can transform birth from something mysterious and intimidating into something informed, empowering, and deeply human. When we step back and look at the bigger picture, the real story of cervical dilation in America isn't just about numbers, centimeters, or timelines. It's about how women navigate choices, how medicine intersects with biology, and how each birth tells its own unique story. For some, the epidural provides the relief they need to face labor with confidence. For others, natural birth gives them a deep sense of connection to their bodies in the process. Neither path is wrong, and neither path makes a mother stronger or weaker. Both require courage, both require trust, and both end with the same extraordinary outcome: the arrival of new life. What matters most is that women understand the realities of how their cervix may respond in each situation. Knowledge takes away fear. When you know that an epidural might slow dilation but can preserve your energy, you feel prepared. When you understand that natural birth can move more fluidly but demands mental and physical strength, you feel ready. Preparation transforms uncertainty into empowerment. And maybe that's the lesson here. Birth is not about chasing a perfect script. It's about being informed, flexible, and supported as your body does the incredible work of opening centimeter by centimeter until your baby is finally in your arms. Every contraction, every pause, every push is part of that journey. Whether you walk it with the help of medicine or guided purely by your body's instinct, you are doing something powerful. You are bringing life into the world. So as we close this conversation, remember this: cervical dilation is not just a medical milestone. It's a symbol of strength, resilience, and the unshakable capacity of mothers. In America, the path may differ, the choices may vary, but the power at the heart of it belongs to every mother, no matter how her story unfolds. So as we bring this journey full circle, let's remember what we've uncovered. Cervical dilation is not just a number doctors track on a chart. It's the unfolding of one of the most profound human processes: labor and birth. And in America, the way that process looks can shift dramatically depending on whether a woman chooses an epidural or walks the natural path. With an epidural, the cervix often opens more slowly, guided by medical support, strengthened by Pitocin, and managed through close monitoring. The trade-off is comfort and relief, but also a greater likelihood of interventions. With natural labor, the cervix responds more directly to the body's hormonal flow, supported by movement, instinct, and environment. The trade-off is intensity, sometimes overwhelming, but also the possibility of smoother progress without as many medical steps. And yet, despite these differences, the destination is the same: a mother, a baby, and the beginning of a new chapter. The real message isn't that one way is better than the other, but that every mother deserves to understand how her choices shape her experience. When women walk into labor informed, supported, and confident, they reclaim power over one of life's most transformative moments. So whether your story includes an epidural, a natural birth, or something in between, remember this: Your strength is not measured in centimeters, hours, or interventions. It's measured in love, endurance, and the courage to step into the unknown and bring life into the world. That's the story of cervical dilation in America. Not just medicine, not just nature, but women, families, and the unshakable power of birth.